Namaskar. Dear learners and viewers, welcome to the session. In this session, we'll be discussing the topics related to the dietary supplements, the nutraceuticals, prebiotics, probiotics, food especially for the dietary use for the medical purpose. So all the regulations related with all these food groups we'll be discussing in this session. This is a part of a syllabus of our two programs which are offered by School of Agriculture, Indira Gandhi National Open University. These two programs are PG Diploma in Food Safety and Quality Management and Masters MSc in Food Safety and Quality Management. In the first year of MSc and also in the PG Diploma program, there is one course, MBP-002, that is on food laws and standards. So their students learn about the different food standards and regulations, laws which are related to different food categories. So students have read about the regulations which are related to the nutraceuticals with the dietary supplements and the prebiotics and probiotics. Again, in the second year course of the master degree, there is one course that is MBP-007, which is about the emerging trends in the food safety. So there are also some discussions on the nutraceuticals and the dietary supplements, prebiotics and probiotics. So this is of interest of our students of MSc program and the PG Diploma program, and it is also of interest of the common public because nowadays in our lifestyle has changed. We see that many people are popping up just vitamins or mineral tablets, especially during the last pandemic COVID-19 situation. We saw that many people are taking so many vitamins, multivitamins, multiminerals tablets just to improve the immunity, just to prevent the infection. So that time, even now also people are becoming more and more conscious about the fitness, about the importance of the health and the fitness. So people are taking different types of dietary supplements, protein supplements, vitamin supplements, mineral supplements, and the nutraceuticals. And in everywhere, in all the media, whether it is print media, the newspaper, or the television, or the radio, means everywhere you can find, you can hear about the advertisement about different botanicals, different products which are of this category of dietary supplements or the nutraceuticals. Even in the market also you can see there are the advertisement for the probiotic food, prebiotics, etc. Okay, so these are very easily available in the market. People go to the shop and buy the dietary supplements, don't even consult the doctor. So the ever-increasing demand for the dietary supplements. In last 2023, the market share of that dietary supplement was almost above 157 billion Indian rupees. So you can imagine means how much is the craze for this kind of dietary supplements and nutraceuticals. So we must have idea of whether these dietary supplements and the nutraceuticals or the prebiotics or the probiotics are easily available in the market, whether these are the manufacturer and the seller of these products are regulated by some regulations in our country or not. So we'd like to know that from the expert we have with us today, Ms. Veenu Taneja, who is the Assistant Director Technical in Food Safety and Standards Authority of India. Her specialization in the area of foods and nutrition. So we welcome you to the session, ma'am.
Thank you.
So I'm just talking about the different kinds of foods, dietary supplements and nutraceuticals, and people are taking those things. So could you please tell us about the regulation, new regulation which came up recently? Because we know that earlier we used to have the regulation that was for dietary supplements and the nutraceuticals and the functional foods and novel foods which came in 2016. So we had that regulation earlier. Now we have a new regulation which came in 2022. So we'd like to know about the new regulation related to these food groups.
Thank you, ma'am. First of all, I would like to thank you for giving me this opportunity to come and present the regulation details to you and your students. Thank you, ma'am. So as you rightly said that the health supplement, multivitamin, the industry is booming, and also people keep popping these pills just like candies. Although health supplement and nutraceuticals have thrived for ages, but it has picked up momentum, especially post-COVID. So with more focus on increasing immunity, stronger bones, skin health, you name a health concern and you have a pill for that. So, and people are also relying more on nowadays naturally sourced ingredients. So they prefer something which is herbal, which is natural. besides the normal vitamin mineral formulations which we had since ages. So understanding the importance of this issue, we had this FSS health supplements, nutraceuticals, FSTU, FSMP, functional food and novel food regulations, which was Gazette notified in 2016. However, we received many representations from various food business operators for some issues which needed more clarity. So in order to bring more clarity and to remove the ambiguity in the regulation, FSSAI has come up with has overhauled the 2016 regulation, and we have draft notified the 2022 regulation, which is like FSS health supplements, nutraceuticals, food for special dietary use, food for special medical purpose, pre and probiotic regulations 2022. And in short, we normally refer it as Nutra Regulations 2022. So this has been operationalized since April 2022. So talking about this regulation, these are the various categories that are covered under these regulations. These are health supplements, nutraceuticals, food for special dietary use, that is FSDU, and we have FSMP, which is food for special medical purpose, pre and probiotic foods. So these are the categories which are covered under this regulation, and to formulate any of these categories, food business operator can use the different ingredients. The ingredients are listed under various schedules. So if we talk of different schedules, we have 4 schedules. Schedule 1 is vitamin. It's a list of vitamin, minerals, amino acids and other nutrients which can be used to formulate a health supplement. We have about 16 vitamins that have been allowed so far, and 15 minerals. We have also listed the source from which this vitamin or mineral is to be taken. For example, calcium, we can use calcium carbonate, calcium gluconate, calcium, other forms of also calcium and other minerals, vitamins. So then we have Schedule 2, which is a list of plants and botanicals. About 439 plants and botanicals have been approved, and a food business operator can use any of this for formulation of a health supplement. Talking of Schedule 3, this is specifically meant for nutraceuticals. We will be talking about nutraceuticals in little detail, but I would just like to mention that the Schedule 3, if a nutraceutical is to be formulated, then one of the ingredients has to be from this Schedule 3. It contains molecules, extracts and isolates of different plants or chemically synthesized compounds also. So we have about 233 ingredients which are there in the Schedule 3 and which can be used to prepare a nutraceutical. Then we have Schedule 4, which covers the prebiotics and the probiotics. So we have about 16 prebiotics which are allowed to be used in this category, and 31 strains that can be used as probiotic supplements. So talking of regulation, so no person can manufacture, sell, distribute or import any of these categories unless they comply with this regulation, 2022 regulation, Nutra regulation.
You want to elaborate this dietary supplements? What do you mean by actually dietary supplements?
Okay. So if we take the definition of health supplement, it is a category of foods which contains a concentrated source of nutrients. It can be protein, it can be vitamin, minerals, amino acids or any other botanical or herb, but the purpose is to supplement the normal diet. And it has to provide some nutritional or physiological effects. These ingredients can be either used singly or in a combination, like a combination of vitamin, minerals, a combination of vitamin and a herb, or in singly. But important thing that is to be remembered here is any of these categories, they cannot intend to treat or cure any deficiency or prevent any specific disease, disorder, or condition. So the thing that is to be understood here is a normal regular diet, when you feel that it lacks some nutrients, then to supplement those deficient or that lack or fill in the gaps, you can take a health supplement. So the rule of thumb is, first we have to try and take all the nutrients that are required through a diet, adequate, balanced, or a diversified diet. The second option, if you feel that you are deficient in some nutrient, maybe for example vitamin D, so we can opt for fortified foods. We have a regulation, Nutrition and Fortification, which lays down standards for fortified foods. So for example, as I mentioned, deficient in vitamin D, so one can take fortified milk or fortified oil. So this will help to take care of the deficiency, because the amount used is very less and there are no chances of toxicity if we consume fortified foods. After considering the second option, if you still feel that there is a deficiency, then we should go for supplements. So talking of supplements, there are few category of people who require supplements. To give an example, very commonly pregnancy, during pregnancy, early stages of pregnancy, or maybe before even thinking of conceiving, folic acid is one nutrient which is required to prevent the neural tube defects. And for that, we need to take supplements, because diet would not be sufficient to take care of the dosage which is required. Also, people who are, they stay indoors, or they are very frail, the elderly people, or maybe vegetarians, they are found deficient in vitamin D, vitamin B12. So such people can also take in supplements. Also, vegan people who are nowadays turning to vegetarianism or vegan, they can be deficient in vitamin D, calcium, iron. So people can opt for supplements in those cases. But if a healthy individual who is taking a balanced diet doesn't need to take health supplements on a regular basis.
Yeah, very good suggestion, ma'am. Actually, you told that for the first step should be the taking care of the balanced diet. We should first go for the balanced diet. If the diet is still deficient in some of the essential nutrients, especially the micronutrients, then we go for the health supplements. But what happens, just for example, if we go for any blood test and you taste the hemoglobin in the blood and you see that the hemoglobin is less in the blood, then we think that we are anemic, we should take some iron supplements. We start taking iron supplements. Similarly with the vitamin D deficiency also. Nowadays lifestyle has changed. We go in the day in sunlight for very less time. So we don't get enough vitamin D, and then we start taking vitamin D supplement as tablet or capsule kind of things. People are, even you mentioned about the fortified foods, but in some it's more or less people are not aware about the fortified foods. Which foods are fortified? Even people are not aware of that thing. Even the fortified milk or fortified other foods, those are not even available in the rural areas. Those are available only in the urban and the A1 cities only. If you think of milk with vitamin D or vitamin A, that is not available in the rural areas. So then people, what they do, they just go to a shop, buy a supplement and they just take it. So that is not the proper way. Then I would like to know from Madam whether everyone should take the dietary supplements, health supplements, or is there a specific group of person? Just you mentioned like the pregnant women, they should take. Is there any other groups or people who should take it regularly on the day-to-day basis?
It all depends. Like pregnancy, you have to take folic acid initially, and in the later stages, calcium iron supplements are given. And the breastfed women is also prescribed calcium supplements. Similarly, elderly people, they are often prescribed supplements. depending on the blood test, if they are deficient in vitamin B12, if they are a vegetarian. Like people who are vegan, what happens is, although we have good plant sources of iron, but because of the dietary fiber present in the vegetarian diet or a vegan diet, it often interferes with iron absorption. So such people, if they are turned to vegan, so they need to take supplements. If you are suffering from diarrhea, then zinc supplementation is given. So it all depends on a case-to-case basis, but it has to be not on a regular basis, only if it is required. Maybe the duration is not fixed. If you are suffering from diarrhea, you will take zinc supplementation only for that duration. If you are vitamin D deficient, you are taking vitamin D supplements, but then you have to check your blood parameters after some time so that it doesn't go into toxic levels. So there is no one rule for all. If I'm deficient in vitamin D, that doesn't mean that you are also vitamin deficient. So it depends on the blood parameters and the condition, the physiological condition.
Very true.
But you have to remember, supplement is not a substitute for a varied diet. The diet is the first line of action. We cannot think that I am not able to, I have a busy lifestyle, I am not able to take a balanced diet, so I'll just take this vitamin and fill in the gaps. So first thing, preference should be a balanced diet, because when you consume a supplement, you are consuming only that particular nutrient. But if, like, for example, you are consuming milk, so you'll get other nutrients as well, like calcium, riboflavin, vitamin D. So similarly, first preference is to consume these nutrients through diet. But if required, definitely supplements are there to help us. Also, in certain medical conditions, for example, if a heart patient, they are prescribed omega-3 fatty acids, or a cancer patient, or a patient who has undergone bariatric surgery. So such patients are advised supplements, but all these are depend on the case-to-case basis. It has to be a personalized approach and not like the trend. People think that it's a harmless trend to take vitamin minerals. It's like a kind of a fashion that I can afford, I can take, I can fill in those gaps. So popping a multivitamin is easier than following a diversified diet.
True, very true. And it happens mostly during the COVID period, COVID pandemic time. That time movement was restricted. People will not be able to consult doctors also. That time they were deciding on their own. And in the various social group, we could see that the people were discussing about how long the vitamins and mineral supplements should be continued. And people continued it for almost 1 year or 2 years. During the whole period of pandemic, they didn't even know about the side effect or the bad effects of taking excess of these good things, because there can also be hypervitaminosis. If someone is taking the vitamin A for too long, if that is not the requirement of their daily requirement, it is more than that, then they can have hypervitaminosis. But a problem is the toxicity problem also because of these good things, good vitamins, right? These are the problems. So whenever we feel like we're feeling weakness, we just decide on our own, we buy vitamins or mineral supplements and we start to taking that one. But I think we should go to doctors. What do you think, ma'am? Should we consult the doctors for taking any kind of dietary supplements?
Definitely, yes, ma'am. One should always consult a doctor before taking a supplement, because as the definition goes, it's a concentrated source of nutrients. So if you're taking through food or a fortified food, there are very less chances of going over the board. It is very less that risk that you will exceed the dosage, the recommended dietary allowances. So it is always better to consult a doctor. So many consumers, they lack the sufficient knowledge. They are not aware of the optimal dose, which is maybe for the different age groups. The dose is different. So they are not aware of the optimum dosages. They are not aware of their different type of combination of supplements that are available, the benefits, their possible interactions, There can be sub-supplements which interact with each other. So like we have nutrient interacting with other nutrients. Like I gave you an example of pregnancy when they take calcium and iron supplements. So both of them are not to be taken together because if you take these supplements, the effectiveness of each other is reduced. Like if you take calcium, then iron absorption is affected. So maybe if you're taking a calcium supplement post meal, and you can take you can take iron supplement with a glass of either a juice or a vitamin C, a fruit. So that would help to help in the absorption of the iron. And calcium and iron are not to be taken together. So also like we have vitamin E and K, they are not to be taken together. If we talk of nutrient and drug interactions, we have iron supplements which can lower the effectiveness of certain antibiotics. So if you're taking an antibiotic for some reason and you have been taking iron supplements, so the effectiveness of antibiotic is reduced. Similarly, calcium supplements also decrease the absorption of drugs which are meant for high BP, blood pressure. Vitamin C, when taken with antacids, can also lead to toxic levels of aluminium. So all these things a normal consumer is not aware of, so it is better that we consult a doctor. Similarly, if thyroid disease is very common, so nowadays, so iron and calcium can reduce the absorption of thyroid medications also. Similarly, we have if you're taking continuously taking calcium and vitamin, just like you said that post-COVID people started taking and they have been continuing, so can lead to extra calcium and vitamin D can lead to kidney stones. And fat-soluble vitamins, definitely they are stored in our body and can lead to adverse effects of toxicity. Vitamin E also, it has a risk to cause stroke because it can cause bleeding in the brain, high doses. So all these things, since we are not aware, it is always better to consult a doctor, or if not possible, then maybe a dietitian who would assess your diet and maybe would be able to tell you after assessment of your diet which all nutrients might be deficient. Like she can assess that if you are a vegetarian, you might need vitamin B12. So that has to be taken at for a specific duration only. It's not that if you are a vegetarian, you'll keep taking it. In between, you need to stop for a few days. You need to check your blood parameters. So it is always better to consult a doctor or a dietitian.
Yeah. Very true, very true. Actually, you always should consult a doctor before taking any kind of supplements. For example, the easy example which came to my mind is that people nowadays, the cardiac problems, the people with cardiac problems, they are taking blood thinner.
Yes, ma'am.
At the same time, they are also taking vitamin K. So these two are antagonistic to each other, right? K is for blood clotting, that helps to clot the blood, and blood thinner does exactly the opposite work. So these two should not be taken together. So only the person who is having that medical knowledge, they can only suggest which should be taken together or which should not be taken. So always we should share with our doctors whatever the supplements we are taking just before any surgery or any kind of medical issues. That's a very good suggestion, ma'am.
Yeah, because this is the drug called warfarin, which has to be, this is a blood thinner.
Yeah.
So vitamin K supplements are not to be taken along
together with blood thinner. Yeah. Then next questions which come to my mind is that when the dietary supplements are easily available in the market, we go to shop and buy any supplements. So what kind of information we should look at in the package or label of the dietary supplement as a consumer?
So first of all, I would like to clear this, that many people think that if it's a herbal supplement, or it is advertised as natural, so they think it is harmless. So this can be a dangerous assumption. Everything which is natural doesn't mean that it is safe. Even natural things can be unsafe if taken in higher doses, or if taken for a longer duration, or maybe if you're taking other medication, which we already discussed. So it is necessary to be little vigilant. Although consulting a doctor is a must, but still we should be, as a consumer, be more careful and consider the label to assess whether we really require the supplement or not. So first of all, we need to see whether the product should mention whether it is a health supplement or a nutraceutical, whatever category it is, whether it is food for special dietary use, FSMP, or a pre or probiotic. And the product
is it mandatory to
label
declare it on the
Yes,
label
ma'am.
of the dietary supplements?
Yes, ma'am. It is mandatory that whatever it is, like if it is a health supplement, it is mandatory that it should be labeled as health supplement, and that too in a bold or capital letters. If it's a nutraceutical, so I should be aware whether I'm taking a health supplement or a nutraceutical. The basic differences, because health supplement is a concentrated source of vitamins and minerals, and if it's a nutraceutical, which I mentioned during the schedules, that they are basically molecules, extracts, and isolates of plants and botanicals. So they are a very concentrated source. I would be talking of nutraceuticals, but it is a mandatory provision to label the product about the category of the product. Besides the category, the FBO has to mention that it is not for medicinal use. If it is for medicinal use, then it will not be covered as a food. It has to be covered under drugs. So it all depends on the dose.
Okay.
So also clear instructions should be there whether which is the target consumer group, like which is it for children, or is it for pregnant ladies, or is it for diabetic patients. So the target consumer group has to be clearly specified. Recommended usage level, that it is to be used for maybe a week or so, and then you need to consult a doctor or you need to stop it. The quantity of nutrients expressed in terms of recommended dietary allowances, this is very important, because if a supplement is providing you 1 RDA, which is like the recommended dietary allowances, these are the levels which are specified by ICMR, and it gives us an idea what is the level of that nutrient which is required to be consumed in a day. So if you're continuously taking a vitamin or a mineral, which is up to 1 RDA, and you're taking a diet also.
That is also having the same nutrients.
And the same nutrients. Obviously, our diet will have a amalgamation of so many nutrients. But if you're taking a vitamin supplement which contains those nutrients at a 1 RDA level, so there are chances that over a period of time, especially fat-soluble vitamins and some minerals, they might get accumulated. So it is very necessary to read between those lines what is the percentage of RDA that is being taken care of by that supplement. So if it's like 100% RDA, then you need to check, because you would be getting that nutrient from food also.
Normal food, yeah.
So you are not, in normal circumstances, we have to stick to the RDAs. So also advisory warnings are required, like a danger may exist with excessive consumption, any precautions that can be taken, some contraindications that this is not to be taken by pregnant ladies or by children. So all these warnings, if a product is not meant for children, so a warning statement that it is to be stored out of reach of children. And besides this, the normal labeling requirements like the expiry date and everything also has to be checked.
Just like any other normal
Just
food.
like any other. These were the
But the
specific.
the special information which are need to be mentioned here, that this is not for the medicine
Not
purpose.
for medicinal use, the target group, duration
And that should
of
be
usage.
written in bold
Yes,
letters,
ma'am.
clearly, right?
Yes,
And it has to also be specifically mentioned for the group of the people it is meant for, whether age group or the different groups, like you said, that pregnant lady or the lactating mother or the diabetic person kind of thing, right? So till now we discussed about the dietary supplements and the importance of visiting a doctor and consulting a doctor just before taking any kind of dietary supplements. We're talking about the regulations which are related with dietary supplements and the nutraceuticals, prebiotics and probiotics. So we'll continue our discussion just after a short break. So we'll take a short break right now. Please stay tuned. We'll be right back.
Do you wish to be part of a television studio like this or any other media system? Or already part of any media system, want to enhance a new set of skills? Welcome to School of Journalism and New Media Studies. Here in the School of Journalism and New Media Studies, we are offering program for all set of people to learn and enhance their media skills. The vision of School of Journalism and New Media Studies is to generate a new set of professionals in the area of media and communication studies with understanding about role of media in the national development and global understanding. We offer innovative programs in the field of journalism and mass communication that sets the benchmark of high quality learning and teaching process at the national level. We offer these programs across the country with the help of our regional network as well as study center. Same manner, many of our programs are offered through online mode with a sophisticated learning management system. SOGNMS offers programs from PhD in journalism and mass communication till certificate level. We have masters in journalism and mass communication. The eligibility is a bachelor's degree, and we are introducing this program in 3 languages: Hindi, Tamil and English. Students from national and international students can join either through online mode as well as in the distance mode. We have 4 postgraduate diploma programs, specialized areas in the field of development communication, digital media, electronic media and journalism and mass communication program. And all these 4 programs are available in distance mode. 2 programs are available in online mode, development communication and digital media. And we have specialized certificate program in community radio. IGNOU employs various media and communication tools for better teaching and learning process. School of Journalism and New Media Studies utilizes this media system for delivering all our programs. Come and join with us for exploring a new career and enhance your media skills.
Dear learners and viewers, welcome back to the session. Today we are discussing about the regulations, food safety and standard regulations related to the health supplements, the nutraceuticals, prebiotics, probiotics. And in studio, we have with us the expert, Ms. Veenu Taneja, who is from Food Safety and Standards Authority of India. So before going to break, we are discussing about the health supplements. So we have covered everything about the health supplements. Now we'd like to know from Madam about the nutraceuticals. So Madam, what do you actually mean by nutraceuticals? Can you give some examples of nutraceuticals?
Sure, ma'am. So nutraceuticals by definition is a category of foods which consist of molecules, extracts and isolates and purified chemical compounds which provide a physiological benefit to maintain good health. And similar to health supplements, they are not intended to treat, cure or mitigate any medical condition, disease or disorder. Before I give some examples, it is important to note here that whether it is any of the categories, health supplement, nutraceutical, or the other categories which we would be discussing, these products shall not include any drug which has been listed in the Drugs and the Cosmetic Act. Also, hormones or steroids or a narcotic drug or a psychotropic substance which has been listed in the Act, DNC Act, are also not permitted to be used under any of the categories in this regulation. Also, parenteral use. We have these IVs, the glucose, which we use for patients. So, parenteral products are also cannot be covered under this regulation. So, to give an example of nutraceuticals, we have a very good example of curcumin. You must have heard that we extract curcumin, which is the bioactive compound, from turmeric. So, whenever we extract such certain bioactive compounds from a food or a plant or botanical, so they are labeled as nutraceuticals. So, they are basically little different from health supplements, because health supplements is more or less a concentrated source of nutrients, vitamin, minerals, and also it can include herbs. But if we are extracting a bioactive compound from a food, then we label it as a nutraceutical. Like if we are using turmeric powder along with some vitamin, minerals, or with any other category, so it can be a health supplement. But if we have extracted curcumin from the turmeric and made it into a nutraceutical, so that is the difference between health supplement and nutraceutical. Also, to label it as a nutraceutical, any of the 233 ingredients which I mentioned in the Schedule 3 are to be used. Only then it can be labeled as a nutraceutical. So we have an example of curcumin. We have about 233 ingredients. Just to name a few, we have lycopene, which is present in tomato. We have tulsi extract. We have brahmi. We have spirulina from algae. So we have coenzyme Q10, which is an antioxidant. Then we have also enzymes such as papain, which is from papaya, which has the property of wound healing and fight inflammation. So all these are some of the nutraceuticals, but it is important to note that nutraceutical also interact with medications. So again, the catch is that we have to, it doesn't mean that it's natural, so or from a herb or from a plant, so we can take it in as much dose and amount. The amount that is to be used has been specified in the regulation. And also, for example, glucosamine, which is used a lot for osteoporosis and osteoarthritis, and chondroitin sulfate. This is a combination which is used. But glucosamine particularly can interact with the anticoagulant medicines, and it can also lead to hemorrhages. So it is very important that the combination is reviewed by a doctor before taking any such nutraceutical supplements. Another common example is St. John's wort, which is used for depression, but again it has adverse effect if you're taking birth control pills. So the effectiveness of that is reduced. Another example, if I would like to quote, is ginkgo ka biloba. So this is a very good, very commonly used nutraceutical, and it helps to improve the blood circulation and also in memory and eye health. But it can interact with fish oils. So if you are taking fish oils for maybe
omega-3 fatty acids,
for omega-3 fatty acids, or for heart health, or for cancer, so then this nutraceutical cannot be used.
So the conditions are same as like the dietary supplements. We should
the ingredients are different.
Ingredients are different, but
yes,
the suggestion for taking the dietary supplement or the nutraceuticals, we should consult a doctor, because we don't know what will react with other nutrients and what will react with other medicines.
Yes,
so better to consult a doctor always. Okay, very good. And then coming to that another category, which is the food supplements for dietary use and the food supplements for medicine purpose.
So for food for special dietary use, we have a category of pre-packaged food which satisfies the dietary requirement of a physiological condition. So the health conditions that are normally covered for FSDU are weight management, obesity, diabetes, pregnancy, lactation, celiac disease, and sports person. So these are the health conditions for which food for special dietary use can be formulated. So normally the ingredients, any of the schedules can be used to prepare a FSDU. Like if you have for a diabetic FSGU for a diabetic patient, so it can include carbohydrate, protein, some vitamin, minerals, essential fatty acids. Maybe if chromium is good for diabetic patients, it helps to manage the glucose intolerance. So they can add chromium to this. They can add dietary fiber. So specific nutrients can be added to tackle the particular dietary requirement of that particular FSTU.
Does it essentially provide all the means, a whole nourishment for that person?
More or less, mostly it is yes.
Okay.
But definitely, as I said earlier, these are not a substitute for a varied diet. If you are adding a mixture of some carbohydrate, protein, essential fatty acids, some vitamin, minerals, but there are still many phytochemicals which you will get in a natural diet. Even the research is continuously going on. We are not even aware. Daily we come up with new researches. So when we consume a wholesome diet or a wholesome fruit or vegetable, so that is definitely better. But in certain circumstances, like a diabetic patient who is not able to take a diet, a normal diet for some reason, if he's critically ill or something, so just to supplement the normal diabetic diet, can consume such products. But again, this has to be taken preferably under medical supervision.
Okay, very good. But what we see right now is that the persons who are very much conscious about the fitness, or the people who are in sports, the sports persons, they replace their meal regular diets with the protein supplements. They are taking, in a regular basis, they are taking the protein supplements. So do you think this is safe for the sports persons to take the protein supplements instead of taking the regular diets?
If we talk of protein requirements, so if it's a normal person, the protein requirement is about 0.8 gram per kg of body weight. We also have protein RDS, which has been prescribed by ICMR. To give an example, if a 60 kg person, a man, protein requirement comes to 48 to 50 grams. But definitely, sports person, they need more protein. For example, if we have a endurance athlete, he or she may require 1.2 to 1.4 grams per kg body weight. And if we have a strength trainer or who are doing high intensity sports, they might require from 1.4 to even 2 grams per kg body weight. But having said that, protein supplements, protein powders, you will find various types of protein powders. So as per our regulation, it is important to note that there is a list of prohibited substances which are not to be used in such protein powders. First of all, the hormones, the steroids are to be avoided, and we also have this prohibited substances declared by the World Anti-Doping Agency. This is known as WADA. So any of the articles which are prepared for a sports person, these substances are prohibited. So it is essential that you are sure that any protein powder should not contain this. Also, if we talk of protein, it is very essential to identify the authenticity and the safety of a protein powder. So you can check the labels. Also, can consult a sports nutritionist. Sports nutrition is a altogether separate field. So depending on the intensity of the workout, depending on how much protein are you getting from your diet, and the rest may be to be supplemented through protein supplements. And the sports nutritionists, they are aware of the brands, maybe the brands which are safe and which have a history of safe use and authenticate. So again, it has to be monitored by a doctor or a dietitian.
So would you like to add up anything about the food supplements for the medical purpose?
Yes. For medical purpose is basically meant for some stringent medical conditions. For example, we have renal patients, we have cancer patients, we have
Diabetic patients.
No, diabetes
That
is a
comes under
normal
diabetes.
physiological condition. You'll find India is the capital of diabetes, so it's a lifestyle disorder. So if you are recommended a FSDU for diabetes, maybe every time you don't have to go to a doctor and a dietitian to consult. But if you are a renal patient, if you are undergoing dialysis, if you have any, if you have a critically ill patient, so for such patients, we also have a category called inborn errors of metabolism. So we have even children who are suffering from this diseases to see, like we have a phenylketonuria. So the FSMP products that are formulated for such patients, they target the specific ingredient. Like, for example, if it's a renal patient, kidney patient, so it is modified into low protein, and maybe sodium and potassium are to be restricted. So they cater to the requirements of those specific category. So for FSMP, it is very essential that it is not available over the counters, and it is to be used only under medical supervision. So no FBO shall advertise the FSMP for general public. And it is to be taken only under medical supervision. Even the dosages and the duration is prescribed by the dietitian or the concerned doctor.
So the dietary supplements, nutraceuticals and the FSDU, these are available over the counter. We don't need any prescription for buying this, right? But for FSMP, so
FSMP is because of
these are
very
not
critically
available over the counter?
no, because it is meant for very critically critical category, very sensitive category of population. Also, other categories we are taking orally. FSMP also covers categories which are given through tube feeds. Like patients who are not able to take food orally. So we have, you must have seen a tube inserted in the esophagus or in the stomach. So all these formula feeds are covered under FSMP. So these are meant only to be given by, advised by a medical doctor or a dietitian, a registered dietitian, so that exact calories, protein, the nutrients which are to be taken care of for that specific disease are taken care.
Okay. So far we have discussed the supplements, the nutraceuticals and the FSDU and FSMP. Now we are left with the two important category, which are prebiotics and probiotics. So I'd like to know about the prebiotics, madam, first.
So prebiotic are basically food that contains added ingredients which are non-viable food components that confer health benefits. So basically prebiotics are the food for the healthy gut bacteria which are there in our gastrointestinal tract. And they are basically the food that helps to sustain these healthy bacteria for long term. Although all prebiotics are fiber, but not all fibers are prebiotics. So to give you an example, we have inulin, we have fructooligosaccharides, galactooligosaccharides, pectin, dextrin. So all these are examples of prebiotics. Again, a prebiotic, if it is taken in an isolated form, or even if in a combination with a probiotic, it will help for the probiotic to be act better. But again, if it is in a food form, so that was even better. So coming to, and you have natural sources also, like oatmeals, banana, potato is also contains dextrin and some starch. We have beans, we have apples which give us pectin. So natural sources, if we take it from natural sources, that is also beneficial, because not only probiotics, we will get other nutrients as well. Coming to probiotics, probiotics is food, the probiotic food covered under the Nutra regulation is food with added viable microorganisms, which when consumed in adequate amount gives some benefits.
So what do you mean by adequate amount? What should be the number of microorganisms in single dose of that probiotic?
So we have a minimum viable number which is either equal to or more than 10 to the power 8 CFU, that is colony forming units, in the recommended serving size. So to label it as a probiotic food, the minimum amount is 10 to the power 8 or more. Having said this, it is important to be sure that the live microorganism, they reach our intestine. So if we are claiming it to be a probiotic, then it is important that the microorganisms, they are viable, they are live till they reach they bypass the stomach acids, the pancreatic juice, the biles and everything, and only then they would be able to confer the health benefits. So nowadays probiotics are being used for almost everything, I think, whether it is digestive health or gut health, or you must have heard of the gut-brain connection, where this is an area which is probiotics are being explored. Then we have memory, for brain health, and also very common is the probiotic which is given for antibiotic, along with antibiotics, antibiotic-associated diarrhea, even in constipation. But we have different strains meant for different purpose. So probiotics with a variety of strains will give you different effect. Also,
you mentioned that the minimum number of microbes should be at least 10 to the power 8 CFU per dose. But if the product is having that number in the initial stage, and if the shelf life of the product is for 7 days or 10 days, do we expect that the number should be there till the end of the shelf life of that product?
Yes, ma'am. We have
so the manufacturers have to
ensure
that
responsibility of the manufacturer. First of all, it has to be maintained at a proper storage temperature so that the live microorganisms are maintained and their viability is maintained. And till the end of the shelf life, the number should be maintained. So that
when the probiotics are sold as a probiotic component only, just like, for example, I should not take the name, but still it's very popular product, Yakult. So it says that it is having 10 to the power 9 or something like that. But when we buy the probiotic dahi, does the manufacturer of probiotic dahi needs to mention that number of the organisms present in that probiotic dahi?
Yes.
Is it there in the packaging label? Can you see that whether it is having that number of microbes or not?
Yes, we have to. It is mandatory to label. Certain labeling requirements are essential, that the FBO has to mention the genus and the species which they are using, because we know that every strain has a different role, a different beneficial effect. So it is mandatory to mention the genus and the species that is being used in that probiotic product, the viable numbers which would be there at the end of the shelf life, and also at the level at which the efficacy is being claimed. Further, the recommended serving size which will impart that benefits. Also, the storage conditions and the best the use, that it is going to maintain this much viability till 7 days or 10 days.
Okay.
So
can you just name some of the genesis which are used for this purpose, probiotic?
Yeah, I have a list because don't remember those names.
No,
one is lactobacillus.
We are taking yeast or we are taking lactobacillus along with card. So that
yeast is also there, but we have very commonly the lactobacillus acidophilus. Then we have lactobacillus salivarius. Then we have bacillus coagulans. Then we have lactobacillus lactis. So different lactobacillus amylovirus, bifidobacterium brevi. So many we have listed, about 31. We have Bacillus indicus, Lactobacillus, Bacillus clausi. So we have 31 which have been permitted, but again one has to be sure that the strains, the viability is maintained till
the storage period,
throughout the shelf life, and also till it reaches the target organ, especially the small intestine.
Thank you so much. We have come to the end of the session almost. So we would just like to summarize the whole session. So today we discussed the regulation, food safety and standard regulation for the dietary supplement or health supplements, nutraceuticals, food for the dietary use, food for special medical purpose, and the prebiotics and probiotics. The new regulation which came in 2022, Madam discussed about the new regulation, the features of the new regulation, the schedules which are there for different category, for defining different categories, for the list of the ingredients which are used in this kind of food product, means food category. Those are also given in the schedule, and also the prebiotics and probiotics ingredients which are mentioned in the schedule. Madam shared some of the name of the microorganisms which are used in the probiotic product. So we could learn about the recommended dietary allowance. Earlier you talk about the dietary allowance. You talked about the different types of the difference between the health supplements or dietary supplements and the nutraceuticals. And she shared very good information that whenever we are taking any kind of dietary supplement, either we should consult a doctor or at least the nutritionist who can guide us at what condition, what type of dietary supplement we should take and how long we should take. We should not continue taking any kind of dietary supplements for too long, because these beneficial dietary supplements, beneficial nutrients in the form of vitamins or minerals or amino acids or some herbal components, that can also be harmful if we are taking over the doses and for the long duration, right? So you have to be very careful whenever we are taking any kind of dietary supplements or the nutraceuticals. Then Madam also pointed out a very good point that nutraceuticals doesn't come under the drugs category and drugs doesn't come under the nutraceuticals category. So there is very clear-cut demarcation between the nutraceuticals and the drugs, right? And there is very clear-cut difference between the health supplements, dietary supplements and the nutraceuticals. And she also mentioned that the kind of protein supplements the sports person takes, that should not also be continued for too long and over the doses, because our body need certain amount of any nutrient. So there is specific level which is prescribed in India by ICMR, what we call as RDA. So according to RDA, if any product is having the 100% of RDA of that nutrient, then we should we should be careful, because we can't avoid the sources of that same nutrients, same vitamins or minerals from the natural food source, our regular diet. We are getting all the vitamins and minerals in little amount from our regular diet also. And we should always keep in mind that first we should focus on our balanced regular diet. Then if it is deficient in some of the nutrients, just because we are not aware of that, we don't have access to the balanced diet, then we should go for health supplements or dietary supplements. If it is not sufficient enough, then we should consult a doctor and go for the nutraceuticals and the medicines, right? So all these kind of information, I think our students are going to get help, and I'm sure that they got some of their doubts cleared from your discussions today regarding the nutraceuticals, the dietary supplements, the prebiotics, the probiotics, and nowadays we also hear about a new word which is symbiotics. So we have just 1 minute. Can you just explain us what is symbiotics?
Symbiotics is when prebiotics and probiotics both are taken together. So it is a very good combination. But again, what matters is the dose and whether the viability remains till the end.
So student, if you still have any questions regarding this topic, you can contact us at the email ID pgdfsqm@ignou.ac.in, or otherwise you can call us at 011-2957-2973 number. So we'll come with another session, another topic, another regulation in the next month. We conduct this program every month, second Friday, television program, and second Saturday, the radio program. So please take care of yourself. Thank you so much for watching this program. Thank you, ma'am, for coming to studio. Thank you.